Recently, there's a drama series telling the work of doctors working in public hospitals. It's pictured based on true stories.
We are also doctors. We always ask patients to take more rest, sleep more, but those who are the most in need of sleep are us. We always ask patients to be optimistic because it will be best for recovery and health. But we can't help being pessimistic when seeing the heavy workload and poor career path. I have to wait for 16 years before I can be promoted to a higher rank, the associative consultant. And the distance is just like that between my height and 170 centimeters, which is so unreachable. I've really thought of going to the private sector because of this heavy workload.
This drama series has raised public concerns on doctors having long working hours. A surgeon from Queen Elizabeth Hospital has some opinions on this issue.
Manpower shortage has been a chronic problem in public hospitals. It is because private hospitals in recent years have been expanding very rapidly, and they try to attract many of our colleagues by offering higher salaries and better career paths. And so the patients in the public hospitals have been suffering from long waiting time before they can get to see the doctor. And so the service quality in the public sector declines.
Are there any solutions?
Well, yes, because some have been suggesting to postpone the mandatory retirement age, and some also suggest to hire overseas doctors. But we generally believe that they are not the best solution. Actually, what we hope is that the hospital authority could do something that can show their respect and recognition of our efforts.
When we are on call, we need to work for 36 hours non-stop. I have a colleague who has been taking sleeping pills for 13 years just to get a good sleep for 3 to 4 hours a day. Some surgeons fall asleep during operations because they can't get enough sleep. The public healthcare system is now on the brink of collapse. Recently, there is the H7N9 bird flu breakout in China, and in earlier times, there's the novel coronavirus breakout in Mexico. What if there's another epidemic disease breakout in Hong Kong? Just think about SARS breakout in 2003. Are we still able to cope with a massive outbreak of disease with the current manpower shortage problem? Luckily, there are still ways to address the problem, and the government should quickly do something.
Want to know the best solution? Read Dr. Koch's essay about manpower shortage. Hong Kong's future is in our hands.